Sores that will not heal. Introduction. Venous ulcers usually happen on the bottom of the foot. Select true or false. Correct. Venous ulcers usually happen below the knee and above the ankle. Venous ulcers happen when the veins in the legs are not working well. Select true or false. Correct. When the veins in the leg are not working well, blood may pool in the lower legs. This can cause pressure that makes it hard for oxygen and nutrients to get to tissue. This can lead to venous ulcers. Arterial ulcers are not painful. Select true or false. Correct. Narrowed arteries make it harder for oxygen and nutrients to get to tissue. Select true or false. Correct. When the arteries in the feet are very narrow, it makes it hard for oxygen and nutrients to get to tissues. Diabetes can cause damage to the nerves in the feet and make it difficult for a person to feel pain. Select true or false. Correct. Diabetic nerve damage in the feet can make it so a person cannot feel pain, heat, or injury to the feet. Diabetic ulcers only happen on the feet. Select true or false. Correct. Diabetic ulcers can happen anywhere, but they are most common on the feet. Pressure ulcers are caused by continuous pressure on an area. Select true or false. Correct. Pressure ulcers are more likely to happen in people who are active. Select true or false. Correct. Pressure ulcers are more likely to happen to people who are bedridden or living with paralysis. All sores are treated the same. Select true or false. Correct. Treatment for sores depends a lot on what kind of sore it is and its condition. Slow healing sores do not need medical treatment. Select true or false. Correct. A sore that is not healing is serious and needs medical treatment. You should clean your wounds regularly. Select true or false. Correct. Clean according to your doctor's instructions. Thank you for using Explain.